Well, Dr. Nachi Sinha is back with us here for one last time. It's the final week, and this latest chapter is called How's Your Constipation? How is your constipation, by the way?
I'm doing fine, thank you for asking, Toby. I'm glad to be back. And nice to see you care about my constipation too.
Yeah, well, it's an important subject. I think it's a bit of a taboo, isn't it, really?
It is important. And that was the idea, right? I mean, the idea was that many times in our lives we find people who might be well-meaning and might not be. That doesn't even matter. But the tendency to ask too many questions and get nosy. For example, how's it going? What happened? And these questions are embarrassing questions not because I'm embarrassed about them, but because they're close to my heart, about my personal life. Just because somebody knows something doesn't give them the right to go on about it, like in grocery stores or in a restaurant, for that matter. So the point, of course, was that sometimes asking or hinting that I don't want to talk about it is not enough.
Yeah.
And when it isn't, then the situation was that you're approached by somebody in the grocery store, and then they start asking you about something that happened, and you don't want to talk about it, but you don't know what to do. And one of the tricks to do is actually to, in a really loud voice, look at them and go, "That's all right, we talked about it, but how's your constipation?"
Yeah.
And that usually scares them and they run away. It really works. And this one, I've had people try it out and it works. So the point there is that this person, who actually gets so embarrassed about something that's meaningless and perhaps not even true about them as constipation in front of a bunch of strangers, that they would run away. And yet they would expect you to answer your deepest thoughts, right? And things that are actually troubling to you, and they almost feel entitled that you've got to give that answer. So how are you becomes, well, tell me about what happened last month or the year before in detail of when I failed my exam. I don't want to talk about it. Let's talk about your constipation.
Yeah. And from the other side, maybe sometimes we think we know someone well enough, we're close enough to someone to be allowed to ask those questions, and then we do, and we realise we weren't as close as we thought.
But then, Toby, there's also this point about closeness and spaces and places, right? I mean, so if that person is actually so close to me, and when asked how's your constipation, maybe they should keep staying there and tell me how their constipation was. So the issue here is not what is right or wrong or good or bad. The issue here is what is private and what's not, right? So the point about the constipation bit is that it's private. Yeah. The only person I would talk to about my bowel movements would be my doctor. Not even somebody who would claim that they really care about me, or if you love me, baby, tell me how your bowel movements were. I don't think anybody uses that. I mean, I hope not, as a sign of proof of love or how close one is.
Yeah. I think that was an old Barry White song, wasn't it?
Well, maybe there was.
Yeah. And I suppose, why did you choose constipation out of all the embarrassing things it could have been?
Well, I had two front runners, hemorrhoids and constipation. So I thought hemorrhoids would be too graphic. So I thought, I'll be a bit nice here, I went with constipation. So I'm trying to be nice, Toby. I'm allowed to be nice once in a while.
Yeah. And what actually gave you the idea to write this whole book in the first place?
Well, it was, it kind of became a bit many people were coming up and saying that, you should get your analysis. People in my clinic, for example, my patients would talk about something else, and then I would try to explain something with an analogy, and they would say, can I record what you're saying, and so on. So it sort of became more than one person saying that you should sort of write something down. And then I realized, and I was like, and brushed them off, and no, don't worry about it. I realized it was purely because of my own laziness that I wasn't writing it down. And then, then I thought that couldn't be a good enough reason. But then still, it was an effort because it had to be constantly chopped up and had to constantly make an effort to keep it as small as possible. Because my concern, Toby, is that when I'm kind of feeling a bit, blue and not feeling up to it, and I want something to read and, sort of a self-help thing, guess what I get? A really thick, fat book of I can't read that thick, fat book
Yeah.
when I'm already struggling, you know. So I didn't want to be that. I wanted to be able to read one chapter, which was 3 pages, and which was actually a story. So it wasn't even telling me that read me and you'll be helped. I don't want that burden. What if I don't get help by that chapter? So I want to carry the responsibility. But I can definitely read a story. And if by reading the story, I get something out of it, well and good.
Yeah. And it's quite good that you manage to give people a lot of help in each chapter. They're only about 3 pages long.
Yes, yes. And trust me, but it took me a long time to write it because to get the idea and then to sort of keep, bringing it down and down and down was, was a bit tricky. And in the sense that it's so easy to make it bigger. And the publisher was going on about, we'll turn each chapter into a book. And I was going in the opposite direction. And so, yeah, I'm glad you liked it. Thank you for saying that.
Yes, well, the latest book, just the book by Dr. Nachi Sinha is called Empowered and Strong, Navigating Safely Through the Storms of Life, and we've had him on 10 times now, so if you're not interested yet, there's not really much else we can do. So where can we find the book if we are interested?
Yeah, I think the e-versions are available, Toby. I mean, Amazon, iTunes, those kind of places that have the e-version. The paperback and all that, I mean, that's available too. But I think the publisher has them priced quite high, and I don't recommend that. Don't tell them I said that. But these days, I mean, an e-reader, iTunes or whatever, that's very easy to use. So yeah.
Yes, great. Well, many thanks for joining us today for the 10th time. You've broken the record. You broke the record about 6 weeks ago for the most appearances of a guest.
Well, there you go. I guess popularity wins, Toby. That's what this is about.